If you're missing 3 or more teeth and are looking for a fixed solution, the implant bridge may be the best option. A dental implant bridge is similar to a traditional bridge, except that it relies on the placement of at least 2 dental implants for support. Dental implants are anchorage devices that require surgery in order to be placed into the bone. While dental implants can experience bone loss just like natural teeth, they cannot develop dental caries like the crown margin of a traditional bridge. Implant bridges are a great solution for patients with multiple missing teeth who would like a fixed dental solution. An implant bridge is the closest thing we can do to giving a patient back their natural teeth. How much healing time is required for dental implants? If extractions or bone grafting is required, healing usually takes 3 to 6 months before implants can be placed. Once placed, implants need another 3 to 4 months to integrate into the bone. Once this has been completed, a final impression can then be made, which we use as a template to create the definitive implant bridge. Within roughly 1 month, the final prosthesis is ready and can be inserted. In total, the amount of time from beginning to end for most patients is between 7 to 11 months. When would you recommend an implant bridge over a traditional long span bridge? An implant bridge is almost always recommended over a traditional long span bridge. As long as a patient is accepting of the surgery required for implant placement, as well as the added healing time, a dental implant bridge is the best solution because it avoids having to prepare healthy adjacent teeth. Another possible complication of a long span traditional bridge is the development of dental caries around the crown margins. Unfortunately, this can result in additional costs, additional chair time, and further complications if the abutment teeth of the bridge become compromised. Maintenance for implant bridges. The best part of maintaining a dental implant bridge is that it is very similar to maintaining your own natural teeth. I recommend brushing at least twice a day and flossing at least once a day. If possible, regular professional hygiene appointments are recommended at 3 to 4 month intervals in order to ensure the integrity of the implant bridge and dentition. I also recommend using a water pick at home to clean around the dental implants and underneath the pontic. At yearly intervals, the implant bridge should be removed for a thorough scaling of the implants. The implant bridge is cleaned and polished in our in-house dental laboratory, ensuring it stays in excellent condition for years to come. How do implant bridges compare in cost and durability to traditional bridges? In general, implant bridges are more expensive because they require the surgical placement of dental implants, which adds the need for another procedure. In addition, special parts are required to attach the implant bridge to the dental implants, something that is not required for a traditional bridge. Over a longer period of time, it is likely that the implant bridge will outperform and outlast the traditional bridge, assuming good oral hygiene and maintenance are being practiced. This is because the most likely way for a traditional bridge to fail is by the development of dental caries at the crown margin, which compromises the integrity of the bridge. This results in a filling needing to be completed or the replacement of the entire bridge, which adds to the overall cost and treatment time. Both traditional and implant bridges are excellent solutions for replacing missing teeth. The right choice depends on your oral health, treatment goals, and long-term priorities. These are all topics that we will cover during your consultation that will help us determine which option is best suited for your unique needs. If you're considering a traditional dental bridge or an implant bridge, contact our office and we'll be happy to help find the best option for your specific needs. Visit www.vividdental.ca to learn more about dental bridges, implant bridges, and so much more. My name is Dr. Arif Sumar with Vivid Specialized Dentistry here in Edmonton. Thanks for watching.